If we saw a person like this, we would notice the fact that there are multiple areas on the skin that are flat but generally hyperpigmented or pigmented a little darker than the normal surrounding skin. We might call this a freckle. If we did, we'd be correct. Another name for freckle is lentigo, sometimes pronounced lentigo. The definition of lentigo is an area of skin that is flat and hyperpigmented relative to the rest of the skin. We could call it a freckle. Microscopically, the reason why it's pigmented, or at least relatively hyperpigmented compared to the rest of the skin, is that there are an increased number of melanocytes. If we go to the edge of the skin here, we might notice that in normal skin, of course this is totally dependent on skin color and race, there are occasional melanocytes, not every cell, but occasional cells, which stipple and live in the deepest levels of the epidermis. You can see some slightly granular melanin pigment here, 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 here. They generally are the domain of the melanocytes, but the melanocytes send processes up into the higher levels of the epidermis, depositing them into epidermal keratinocytes as well. Notice that in some areas these melanocytes are a little more common and densely populated than others. An area which we see in the skin as being pigmented or hyperpigmented is on the basis of an increased number of melanocytes. Not only are they here occasionally and very subtly in the deepest epidermis, but now we could see that some of these some of the melanin granules have been deposited in the dermis as well. Some are within melanocytes, some are secondarily within melanophages or macrophages, which eat the melanin pigment. This is a classical appearance of a freckle, or lentigo. Thank you very much.